Is your dog becoming increasingly listless and short of breath? He may be suffering from heart failure. But how do you recognize heart failure in dogs, and what can you do about it? Read this article to find out all you need to know on the subject, so you can keep your dog as healthy as possible. What are the dangers of heart failure in dogs? Heart failure in dogs can, sooner or later, lead to inevitable death if left untreated. This disease is a gradual process that can only be slowed down with the help of appropriate medication. If your dog suffers from heart failure, you need to take his condition very seriously. It's essential to visit the vet regularly for checkups. How does a healthy dog's heart work? To better understand the onset of heart failure in dogs, let's take a closer look at the anatomy of the heart. Anatomy and function of a dog's heart. The heart is composed of two ventricles and two arteria, right and left. Oxygen-poor blood circulating throughout the body is drawn into the right atrium via the vena cava, then into the right ventricle via the tricuspid valve. When the right ventricle contracts, the blood is transported to the lungs through the pulmonary arteries, bringing oxygen to the blood. The blood then crosses the pulmonary veins into the left atrium, and continues through the mitral valve into the left ventricle. Oxygen-rich blood then leaves the heart via the aorta to distribute nutrients to the body through the peripheral blood vessels. What are the different forms of heart failure in dogs? The term heart failure does not describe a specific disease, but only the syndrome of heart failure itself. Heart failure is caused by various diseases, both of the heart and of the surrounding organs. Heart failure can occur as a result of reduced blood flow, hypovolemia, or be caused by congestive heart failure. This causes congestion of blood in the veins, and can affect both the right and left sides of the heart. Congestive heart failure. Veterinarians differentiate the causes of congestive heart failure between right and left heart failure. Left-sided heart failure, this is by far the most common heart disease in dogs. Although some breeds of dog, such as the Cavalier King Charles Spaniel, suffer from mitral insufficiency from an early age, due to genetic predisposition, in most cases it affects older dogs. Very often, dogs suffer from endocardiosis, a degenerative disease that causes pathological thickening of the mitral valve. As a result, the valve is no longer watertight, leading to a reflux of blood from the left ventricle into the left atrium. Gradually, the atrium becomes enlarged, and blood flows into the lungs or the right side of the heart. In addition, narrowing of the mitral valve, mitral stenosis, malformations, for example a left-right shunt, or dilated cardiomyopathy, enlargement of the heart's ventricles, can also develop into left-sided heart failure. Right-sided heart failure, this is less common in dogs, and is caused by tricuspid insufficiency. But accumulations of fluid in the pericardium, pericardial effusion, pulmonary embolisms or advanced left heart failure also restrict cardiac function due to congestion. Hypovolemia. Hypovolemia is caused by a reduction in cardiac output, which is the volume of blood flowing through the heart per minute. It can be caused by left-sided heart failure or right-sided heart failure. Symptoms: recognizing heart failure in your pet. Heart failure alters your dog's quality of life due to various associated symptoms. General symptoms: fatigue, dog no longer eating, weakness, agitation. Left-sided heart failure, dog coughing, respiratory problems, respiratory distress, increased respiratory rate, cardiac arrhythmias, syncope. Right-sided heart failure, cold extremities and fluid retention, pale mucous membranes, respiratory distress, stomach ache due to possible congestion in the liver. If the heart is damaged to the point of heart failure, the dog will die of heart failure without treatment. Diagnosis: what tests does the vet carry out? Owners usually become aware of a heart problem when their dog shows increased fatigue and weakness. A visit to the vet is advisable. During the preliminary examination, anamnesis, the vet asks important questions about the onset of symptoms. Then, as part of the clinical examination, the heart is examined in greater detail for the first time. The veterinarian determines the dog's heart rate, respiratory rate, and other vital parameters. In a special cardiological examination, the veterinarian or a specialized veterinarian, cardiologist, examines the heart from every angle. Using a stethoscope, he or she listens to the heart rate, evaluates pulses and is alert to any heart murmurs. For a visual examination of the heart, the veterinarian may call on medical imaging procedures, such as X-ray or cardiac ultrasound. The latter has the advantage of showing heart function in real time. With an X-ray, it is only possible to assess the size of the heart and surrounding structures, such as the lungs or diaphragm. To rule out arrhythmias, the veterinarian completes the examination with an electrocardiogram. To measure the heart's activity, the vet places electrodes in the dog's armpits, and in the crease of its knees. The curves displayed on a computer allow the veterinarian to analyze the animal's cardiac activity. As heart failure in dogs is a progressive disease, it can be classified into 3 or 4 stages, depending on the schema used. Different stages require different treatments and have different prognoses. Treatment: how to treat this canine disease. When and how a veterinarian can treat heart failure in dogs depends on the degree of severity of the disease, as well as other factors, for example age. In general, it is not possible to treat the cause of the disease, but the following measures can help improve your dog's quality of life. A vasodilator ACE inhibitor, for example ramipril, and water-draining diuretics, for example furosemide, increased heart pumping, for example pimobendan or digitalis, nutritional measures, low-salt diet. Avoid heavy stress. Prognosis: what is the life expectancy of a dog with heart failure? Unfortunately, the cause of heart failure in dogs is rarely curable. That's why it's all the more important to start treatment as early as possible. The prognosis for chronic heart failure is much better if your dog is on a controlled course of medication. However, if your dog goes untreated or suffers acute heart failure, the result is often death. Prevention: how to avoid heart problems. In principle, heart failure in dogs cannot be prevented by preventive measures. Nevertheless, it's important to give your dog a healthy diet and plenty of exercise. At all costs, avoid overweight dogs. Have your dog examined regularly by a veterinarian. At the annual visit, if a heart murmur is detected early enough, it can be examined and treated quickly. Dogs with a family history of heart disease should be excluded from breeding. Thanks for watching the video. Don't forget to subscribe to my channel and hit the button of notifications. See you soon in another video.